Hello, good evening, good morning, good day, wherever you are seeing this video. Thank you so much for joining me. For my few subscribers, thank you so much. I really appreciate you. And for those seeing this video for the first time, please consider subscribing, sharing, like, and comment. This is a video, unfortunately, I had to um, uh, record again. Hopefully, I've got all the information that we need because the previous one was so full of content. But I'm sure this will be as good as the previous one. I'm having a few technical issues, as been mentioned. I'm aware of them. Yes, I'm working on them pretty shortly. Hopefully, things should improve. I'm not sure if it's going to be totally improved, but it will improve to some extent, and we will all be able to enjoy listening and then making the contents. And thank you so much. And my name is Janet, and this channel is the Kosh TV, backed by aspects of professional, very, very knowledgeable in their various fields of profession. So we promise to give you all the information that are at our disposal for us to improve the well-being of the family and then the community as a whole. Okay, and the expert, that's the Kente of Experts Club International, are so grateful for you for joining us. Okay, today we're going to talk about infection control. If you work in the NHS, any National Health Service, I'm sure it's been mentioned over and over again. We've done readings, we've gone through standards, we've gone through protocols several times. I mean, it's there, we mention them all over again. But the way I'm thinking about it and I intend to talk about it today is we know these standards, we know the procedures, we know the protocols, but to what extent do we actually apply them to our practice? Do we really apply them to our practice? Do we practice them? Or do we just know them and that's it? In many cases, we don't. I'm not saying everybody. I've seen colleagues practice very good infection control practices, and some not too well. It happens sometimes. Pressures of the job, so we tend to forget certain things. But honestly, with the way things are going this day and age, it's so important for us to be putting whatever we've learned into practice. It's so important. So I am going to talk about it in such a way that we will try to remember them, we will try to put them into practice. All right? According to I'm going to do a couple of readings. According to the standard infection control precautions, okay, it says infection control are the basic infection prevention and control measures necessary to reduce the risk of transmitting infectious agents from both recognized and unrecognized sources of infection. Okay, so it's basically trying to control infections and then curb them to minimize the transmission of the infection, not just to the staff or healthcare worker on the shop floor or attending to a patient, but also to visitors that actually come to our healthcare facilities. We need to bear these people in mind. So, if we are talking of infection control, we need to remember that if there is any outbreak or anything that needs to be, anyone needs to be protected against, when they come in, when visitors come in, we need to ensure that they go through the necessary procedures, just as the COVID period we're all frantically trying to do. But that doesn't mean that if the pandemic or epidemic goes away, we should forget infection control. No, infection control should be continuous. Okay, yes, there are situations when you would have to reduce probably your PPE, you custom it to whatever you're doing, but that doesn't mean that you should ignore the practices at all. No. Okay, so I just put something through my reading. I just put a few things together, and this is what I said. I said it's a set of guidelines that ensure patients and healthcare workers are protected from avoidable infection, just like I explained earlier on. So it's actually guidelines that we use to make sure that ourselves, the patients, and then the visitors or the community that we come into touch with are protected from those avoidable infections. There are those that we can avoid. I mean, we can prevent from happening, and that it's there. But those that we can, we need to put in our best efforts to make sure we we kept down the transmission of these infections. Now I'm going to talk about the elements. Okay, so there are 10 elements for the standard infection control precautions. All right, it talks about the patient placement and assessment of infection risks. Okay, I'm going to touch on them briefly, but I intend to talk about two of the points. I intend to explain a little bit more two of them. Okay, so the first one that I am mentioning now to you is the placement and the assessment of infection risk. Okay, so let's say you are receiving a patient into your cubicle, your ward, wherever it is. You would have been given some information. Is it from the ambulance crew? Is it from the family? Is it from the patient themselves? If or you may have noticed some signs of infection. Okay, so when you notice this, what do you do? Okay, as a health professional or as you, the nurse, you have to put measures in place to make sure that whatever you have noticed does not spread to other individuals in the environment or in the area or in the setting. Okay, so basically that's what that means. Putting measures in place so that whatever a patient comes in is carrying does not spread to the others. Do you have to put on a set a special tray for the person? Does the patient needs to be in isolation? Do you just have to change the curtains and make sure everyone is protected, or pull the curtains to make sure everyone is protected? That's all that this means, okay? And our hand hygiene, the second one is our hand hygiene. I mean, everyone through our trainings we've done of the techniques of hand hygiene, how to wash your hands and all that. Okay, so we've learned that. Okay, it doesn't end there. What about your contact with patients? Okay, so anytime you are going into contact with the patient, what do? You need to perform a hand hygiene procedure. If your hand is clean enough, your hand sanitizer should be good. Please be mindful that let's use the one provided by the hospital unless there is a contraindication or there is a reason why you have to use something different. All right. So this as standard procedure. Let's do that. There are some fragrance one out there. I mean, I'm guilty of it myself. I have used some previously, but let's use what has been provided by the hospital, by the healthcare facilities. Okay, so you moving from patient to patient. Okay, you've seen this patient, you've touched the environment, you're going to move on to the next patient. Okay, you wash your hands. You've touched honestly, I love washing my hands. I know sometimes too much of it isn't too great, but you wash it. But if you're happy with your hand sanitizer and you think you haven't actually come into contact with anything that is likely to spread any infection, use your hand sanitizer and then move to your next patient. All right, let's bear that in mind. Now, respiratory and cough hygiene. Okay. I know some of you may be thinking about the COVID outbreak, the TBs, and chest infections and all that. Yes. COVID outbreak, I know COVID infections. We know what to do. We try. We do what I know because of how severe it was and the scare is actually brought about. So measures are being taken. I know that. TB, there is a standard procedure. As soon as it has been identified that the patient is infected with the bacillus, we actually, we put measures in place to actually protect everybody who comes into contact with the patient or the patient surrounded or the patient is isolated. Okay, but what about you, the healthcare worker, or you, the nurse, who is feeling a little under the weather with some cold? You're not sure whether it's a chest infection and some cough, but you still need to go to work. Yeah. Sometimes you just can't help it. You need to go to work. You are probably needed, or you probably need to actually make the hours. Please, 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 please. When you are on the shop floor, when you are among colleagues, when you are close to your clients, when you're close to the people and then you cough, let's make sure we cover our mouths. Very important. It's very easy for these particles to fly in there and then we catch them. So let's make sure you use a tissue, cover your mouth, wash your hands. If there is a situation that the corner of your arm like that, use it. Okay? Use it. It's so important. So let's protect ourselves and let's protect those around us. Okay? And then the next one is personal protective equipment. We all know how to use these things and we know what time to use them. You're dealing with fluids. Yes, bodily fluids. You need to down your gloves. You need to down your apron and your mask. We know there are different types of masks that we use depending on the situation you're dealing with. There are those that comes with the screen. There are those that comes with just the mask. So let's use the appropriate PPE for the appropriate procedure or activity. Okay. And then the safe management of the care area. Yes, the safe management of the care area. Very, very important. We tend to ignore little things. And unfortunately, these are the things that are mostly to lead to infections. Let's say for the treatment area, I'll start with you taking your handover when you arrive on duty. Okay? We've traveled from home or we've walked from home to work. You've taken your handover. What I do recollect, my early years, early days in nursing. After handover, we do a bit of cleaning. that's on the ward anyway. I know sometimes there are some areas that it can be so busy, but if the job is well allocated, I think we should be able to cover these areas. Now, you wash your hands after you've taken your hand over. You clean your nurse's station. The nurse's stations must be clean. The keyboard, because the group before you, the team before you have finished, they've left and gone. Okay, so to minimize whatever they may have carried from infecting those of you who've just arrived, let's clean our nurses station. Let's clean our work areas. Do you have a PC sitting on a trolley that you move around in your work area? Clean that. Clean it, make sure you clean it. And then the treatment area, the treatment room, treatment area must be clean. Where the medications are prepared, the IVs and all those are prepared, it needs to be cleaned. The bins and everything, all those has to be checked. And it's so important that we bear in mind that it's necessary to clean after ourselves. Do not leave it for someone else. It can be upsetting sometimes when you get there and probably you're so much under pressure and you really need to prepare something quickly, and somebody has used the trays and then left them like that unclean, and then you will have to go through the process of cleaning it and using all those wipes clean before preparing yours when you actually have an emergency and you have to run to go and attend to another patient. So these are the little things I'm talking about. We tend to lose sight of them. Let's bear those in mind. I know we choose the profession because we love it. Yeah. And we think about the money to buy you love. Well, I mean, it's the love for taking care of the patient. That's why we are there, you know. And for yourself, you need to love yourself to be able to protect yourself. So we need to bear those in mind. So important. Now, and then the safe equipment of care, safe management of the care equipment. These drips are usually, depending on what your healthcare setting is like, I've been to places or I've worked in places, with some hospitals that I've worked in where there are a special place where drip stands are actually kept. Okay, drip stands, and then the infusion pumps have their special rooms or storeroom where they are kept. And before you put them there, they need to be cleaned. I know sometimes we just take the thing and quickly we just push it in the rooms. No, before you pull them away, they need to be cleaned so the next person can come and pick it up. I mean, sometimes just to be sure of myself, to have that conscience that okay, it's clean, I'll quickly give it a wipe even when I'm going to use it. Okay, so let's bear those things in mind. Care equipment, very important. Your trolleys, your trolleys, the phlebotomy trolleys and all that. We need to be cleaning them. We need to clean them after every use before we store them away. All right? And then safe management of care learnings. I mean, there is no a huge scientific evidence about this. I mean, it's like an ABCD. If the patient has infection or a patient has some sort of loose stool diarrhea and you are a bit you are concerned, I mean, anyway, any soiled clothes should go into the dissolvable bag. We know that. And you should put them in a red bag. Okay? So So those soiled ones and those from patients who are infected, have infections that we have isolated, we know that they go into the bread bag, and there is and you tie them and then you put them away. These things I know we wouldn't lose sight of. We do them, don't we? We do. We all do. Just bear in mind. Tell yourself we do. Let's bear those in mind. Okay, it's important. Any linen used, the patient leaves, clear the bed, clean your bed, put the bed in the appropriate container. The word isn't coming. The appropriate place where the those responsible for the collection of the linens can do their jobs, and they wouldn't come and then things are put anyhow, and they would also be you know what happens when they come and then things are left on the floor and left anyhow. Let's tie them properly, make sure they are well stored for them to also collect it as it's supposed to be, so that the work works, the job goes in that direction. Okay, uniformity, there is consistency in what we do. Okay, so when we come to the safe management of blood and bodily fluids, our PPEs comes into place here. But when we are dealing with the bodily fluids, our PPEs come into place. When it comes to blood transfusion, handling blood products, you don't necessarily need to wear an apron, but sometimes you can not really tell what happened, especially during the connection process and all that. So if you are a bit clumsy like me, then put on your apron and don your gloves as appropriate, so that you make sure that whatever you were doing, it's contained, it wouldn't soil the patient's clothes or the bed linen, so that everything is done clean and neat. Okay, safe disposal of the sharp bin. Safe disposal of the sharp bin. Most of us are guilty. We go to dispose of our sharps and we realize that the sharp bin is full, but we still try to put in more waste. First, that's a health hazard. Risk management. You need to think. If it is full, usually should be, I think, 3/4, right? 3/4 full. Close it and then label it as appropriate, and then get another. Look, if you're that busy, okay, and it's full, or you cannot go and get another, close it, label it, and if someone comes and the person needs another, they would go and get it. Don't try. I'm not saying that what I'm saying is right. It's good, a good practice, but it's better than putting in more sharps into the sharpening when it is full. That's very risky. When you close it, when you are the last person to put in, you think and know that it is full, and then you close it and label it. Okay, if you do not take it out or you put it in a safe place, and I come in and I see that it is closed, the bin when it's closed cannot be opened, and I need to dispose of my sharps, I will definitely go get another. So please, let's bear these things in mind. Okay, very important. Occupational safety and managing prevention of exposure, including sharps. If you didn't listen to me carefully, you may have heard about me about donning your PPE and making sure that when you move from one person to the other, one patient to the other, you use your hand sanitizer. If you've got a cold, you cover your mouth when you cough as appropriately. You dispose of tissue properly and hand washing. Okay, so all these come under the safety, occupational safety, and the managing of the managing and then prevention of exposure. So here, if accidentally you should have an accident from the needles, you know what to do. Run it under running water, squeeze it under running water, okay? Inform your NIC and then report to occupational health. If occupational health isn't there at the moment, you should speak with a doctor. That's important. So to prevent all these needle pricks, I'm not saying it will never happen if we close our bins and then dispose of our sharps appropriately. It's likely to happen. But if we should adhere to protocol and then close these bins as appropriately, we've taken some percentage from the risk of having needle injuries or sharp injuries. We've taken some percentage off. I don't know if you quite understand what I'm trying to say. We've taken the percentage of being at risk of having an injury from these sharps off when we close our bins appropriately as by protocol, as by the procedure of your work setting. Okay, that is something I would really like to talk about. That is the consulting rooms, the treatment room where we receive patient, where we assess patient. We need to pay attention to those places. Okay? Hats off to all the doctors and then the practitioner out there who see patients on their own. But we need to make our patients comfortable when they come to us. You do not want a patient walking into your consulting room or your treatment room, looking at the couch and feeling apprehensive to lie on it to be examined. Before you start your duty, you start with your responsibility. If you feel that your consulting room needs to be cleaned, and you are unable to do yourself, or there is someone who has been charged, who has been allocated that responsibility, let them know. Let them know. I know why I brought this up. No patient wants to lie on a couch that seems to be unclean. And I bet you, the health professional attending to the patient yourself, wouldn't lie on that couch. So it's important we keep them clean. If we are unable to clean them clean, this is a suggestion and appeal to the managers, to the directors of various health settings. Is it still possible for us to have the paper rules for the trolleys back? I know there was a reason why most of them have faded out of the system. But if the same couch or trolley is going to be used to assess, they are not put on trolleys, they are put on couches to assess a patient, and you are unable to clean the couch after every patient, then let's use the paper roll. Hats off to my dentists, my dental surgery. They do really well. Hats off to you. Let's keep those things in mind. Let's keep those things. You don't want to be seen and then all you're thinking about is getting home and then having a wash or a shower. I don't mean to sound nasty, rude, no. But if I haven't seen it, I wouldn't say it. And the pressure on the health services is getting bigger. So let's not make it worse. It's getting bigger. Let's not make it worse. Sometimes it doesn't take much to put something right. I know. It's tough out there, but please, let's do it together. Let's help each other out. Let's take our responsibilities seriously. Just that when you finish your duty, you're so eager to get home to have a shower and lie down. When you come on duty, make sure you put the same effort into what you do. Look, the patient is relying on us. The patient is relying on you to get better. Let's not make it worse. Let's not make it worse. Let's show that example, because you are an advocate as a health worker. You are an advocate as a nurse. You are there to educate the patient how to take care of themselves, how to prevent infections. So you are the first role model to them. Do it for them to see, do it for them to know. Not just because you are a nurse, no. Because you know the right thing to do. Thank you so much for listening to me today. Please consider to subscribe, share, comment, and like. And as I always say, remember, you and your community are responsible for the well-being, for your well-being. So let's make it a point to make a positive impact or influence wherever we are. Thank you. Till I come your way again, I say keep healthy and bye-bye.